We're trying to look at the concept of catheter ablation. Once you hear the name ablation, you just see like they're trying to stop an abnormal stuff. Okay, so catheter ablation is quite a thing, and you are doing this when the heart is not conducting impulses as it should. Do you understand? So you are doing this to stop the abnormal impulse conduction in the heart. All right. So you can see these are different pictures of catheter ablation. So you are passing a catheter to probably shock an area of the heart and make it start working properly and all that. Okay. So we'll be talking about this, we'll be defining it, talk about the indications like types of disease conditions where you should use this type of treatment. You are looking at the procedure, that's how to do it. All right, then you are looking at the types of ablation. They are trying to look at the benefits of this ablation, like um, if you do it, what are the advantages? Then we're looking at the risks and complications, right? Because it's a minimal invasive surgery, but yeah, almost every type of surgery actually has their own complications, right? So for the definition, we said that the catheter ablation is a minimal invasive procedure to treat arrhythmias. What is an arrhythmia? Arrhythmia is when the heart is not beating as it should, right? It's irregular. Okay, arrhythmia could be that the heart is beating too fast or too slow. All right, so you are trying to treat arrhythmias by destroying the abnormal electrical pathways of the heart. Okay, indications, that's like types of disease conditions that this type of medication is can be used. All right, if the patient has supraventricular tachycardia, have atrial fibrillation, have atrial flutter, has ventricular tachycardia, has Wolff-Parkinson-White syndrome. That's a congenital, like it's a type of condition where the patient is giving birth to it. Normally, like the heart is not conducting impulses as it should normally. All right. So the procedure includes you insert the catheter through any vein in the arms, or if it is an arm, then probably maybe the cephalic vein or something. If it is in the leg, then try to like the femoral vein or something. Okay, so when you insert it, maybe through the femoral vein, so you now trace it down to the word inferior vena cava, right? Get into the heart. All right, then you guide the catheter to the heart using fluoroscopy or endocardiography. Then you now map the electrical activities to identify the abnormal pathways. Then you now deliver energy to destroy the abnormal tissue. Okay, the energy that could be discovered could be what delivered could be radiofrequency or cryoablation. Anyone? These types of ablation. Let's talk about it. Okay, yeah, radiofrequency ablation, which is heat based. Then we have the cryoablation, which is what cold based. All right, there could be laser ablations too. For the benefits, it actually has a high success rate. It's a minimal invasive surgery. That means you are just putting it through this vein. You're not actually opening the patient up like they're actually doing the open surgeries, right? Then there's a reduced risk of complications. Right, like the wound is small, the surgery is small. Okay, everything is just smart. So there's reduced risk of complications. There's improved quality of life because the patient does not have to do all those long hospital stays, all right, to recover from an open surgery because this one is minimal invasive. The risks and complications, it could result into what bleeding or hematoma, result into infections, result into a damage to the surrounding tissue, result into a stroke or a TIA, that's transient ischemic attack, right? Cardiac tamponade could also be a complication of this type of what treatment. Okay, so I feel like the advantages actually outweigh the disadvantages, and being careful, you might actually what avoid some of the disadvantages that could actually occur here. Okay, so that's it for catheter ablation. See you guys.